Yeah, okay. Welcome everybody to this session on the panel on health for all, looking at the underserved and how we can reach them. And the European Commission sponsors this event together with all the other organizations supporting this area of international cooperation, because global health is one of the key priorities of our development programs. And my name is Jan Paehler. I'm the head of the health team in the European Commission's Directorate General for International Development and Cooperation. Health is a human right. No one should get sick and just die because they're poor. I think those are values that we all share. Everybody should have access to the health services that they need. But access to health care is also an essential building block for well-being, empowerment, and economic development. We need good health to attend school and work for a more prosperous future. And the EU, the European Union member states, are operating their health systems all individually by themselves, but they share the same values on which these systems are based, so that there is a universal access to good quality care for everyone, and nobody should fall into poverty because he's ill. And the EU applies these principles not only for our own countries, but also for our external policies. And we realize that even in our own countries there are inequalities between the rich and the poor, and in health more broadly. But there is also, of course, an inequality between countries, the rich countries and the poor countries. And poorer countries obviously have it much more difficult to address the inequalities in their own countries if they don't have the resources by themselves. So the challenges are clear. At least half of the world's population still do not have full coverage of essential health services. About 100 million people are still being pushed into poverty because they have to pay for health care. Over 800 million people spend at least 10% of their household income on health, which is a lot of money. So this panel will look at the barriers for people to access effective health care in the countries where we come from and across the world, and provide concrete examples from their work what can be done to address these challenges. It would also illustrate the partnerships that have been established and that are necessary to address these challenges together. So we have assembled a wonderful panel with different backgrounds and experiences, and each one will give us in turn their personal report on how things have spelled out and what they can do and what they have learned in order to address the challenges ahead. So I would like to introduce them in turn and start out by Akosua Peprah. Akosua is the founder of the Mmaakunium Foundation, a social initiative to educate, create opportunities and make resources available to marginalized women in Ghana. Through this foundation, Akosua engages with peers and experts in disadvantaged communities. She's also working with the government officials to influence policy and make education accessible to children in rural Ghana. Akosua also launched the Happy Flow project, which facilitates access to hygiene and sanitation for 135 girls aged 13 to 18 living in Damongo in northern Ghana. So I would like to hand over to Akosua, please.
Thank you for the warm welcome. So my name is Akosua Peprah, and I am the founder of Mmaakunium Foundation. Mmaakunium means victory for women. So our work focuses on girls' education. We do things to make sure that girls get access to quality and equitable education and also succeed in school. So because this is a health panel, I'm going to focus on the health aspect of our work. Our work focuses on menstrual health, menstrual hygiene, and also we all do sensitization workshop on sexual reproductive health rights. So on average, girls miss 6 to 7 days of school due to their periods because they don't have access to sanitary pads. And the government in Ghana right now charges 20% tax on sanitary pads and categorizes it as luxury goods. So luxury goods means that only the rich have their periods, but we know that is not true. So it becomes so expensive for young girls to have access to sanitary pads. So with the health implications, girls tend to use unhygienic materials. Some of them use rags, some of them use used clothes, some of them use banana fibers, and this has serious complications on their health. So out of frustration of the girls missing 6 to 7 days of school, they drop out of school. And once they drop out of school, they become easily targets of child marriage. So child marriage, we know child marriage complications is like obstetric fistula. Also because we don't have reproductive services targeted to rural girls from poor families, they don't know about reproductive health rights. So then they become pregnant at a very young age, and some of them also acquire STDs. So our work is to make sure that the girls have basic needs to sanitary pads, because if you look at it, sanitary pads has serious health complications on their education, and we know that not having access to good education is also a serious issue. So we make sure they have access to sanitary pads, they stay in school, they succeed in school, and we also make sure that we work with the government to reduce taxes on sanitary pads because it's a health issue, and also make sure that they have access to reproductive services free of charge so they can succeed in their education. That is all I do. Thank you.
Thank you very much, Akosua. The next to my left is Eduard Molnar, the Senior Manager at GAVI, the Vaccine Alliance. Eduard started working at GAVI since 2013. He has a Master of Science in Social Sciences from Long Island University in New York, as well as a BA in Political Science from Hunter College in New York. Before joining GAVI, Eduard held several key positions at UBS and JP Morgan in Geneva, Zurich, and New York. And while he is American, he has lived in the USA, but also Morocco, Italy, Romania, UK, and Switzerland. Eduard.
Thank you. Proverò per prima a parlare un po' in italiano perché ormai...
Okay, I'll try and speak Italian because that's a language that I like very much. So thank you very much that you came all over, especially during lunchtime, on such a hot day on which you could have been at the beach. So first of all, please raise your hand. How many of you have heard about GAVI? Have you heard about GAVI? And have you heard about the GAVI, the organization, and not the GAVI wine? How many of you are familiar with GAVI, the organization? Right. So 2 people, only 2 people. So I'd like to, first of all, start with the video so that we can tell a little bit more about the association.
Grazie.
Thank you. Okay, now I'll shift to English because all the terms that I'm familiar with are in English.
GAVI was founded in the year 2000, and it's almost 19 years ago, almost half the time that this very conference of Rimini was founded. So you basically have double the life of GAVI. We have just become a young adult, and in our life as a young adult, we have managed to vaccinate 12 times the population of Italy, which is about 760 million children, saving thus about 10 million children. And I think that number speaks for itself. I would like to also say that prior to GAVI, which was founded in the context of the World Economic Forum in Davos, children in the lower income countries did not have access to the life-saving vaccines that your children, yourselves, have access to in Italy or elsewhere in the what we call the developed world. So what GAVI's mission is basically to save children's lives, to provide access to these life-saving vaccines regardless of race, gender or religion, which I think is also one of the very mottos of this conference here. In the years to come, we're looking to, or we would have vaccinated the equivalent of the entire population of Europe and the United States together. So that is about 1.1 billion children up to 2025, and that would have saved about 22 million lives. GAVI as an organization is a private-public partnership. It's a unique combination in the development world in that it works with civil society organizations, with donor government countries, with implementing countries. It also works with the Bill and Melinda Gates Foundation. It works with UNICEF and WHO, as well as with the World Bank, technical experts, and so many others. So, whereas we're a relatively small organization based in Geneva, our impact is felt across 73 countries, and especially in the countries in the lower income countries, the poorest of the poor. I think, and unfortunately the time that I have here does not allow me to talk everything I would love to share with you about GAVI, but a personal story. I went to Mozambique 2 years ago, and it was my first time visiting one of our implementing countries, and there I saw a mother who brought her albino child, and she had told me that she had walked for about 22 kilometers in scorching heat to have her child vaccinated. And when I asked her, why would you do that? Because, to walk basically the equivalent of going from Rimini to a neighboring town and back, why would you do that? She said, I want to make sure that he gets to live, unlike my 3 other children, whom I could not bring to be vaccinated because I was working in the field. And I think that impressed me on 2 levels. One, here you have a mother who brings her albino child, and as you may know, in some of the African countries, having an albino child is a stigma. Many of these albino children are even killed because it's seen as a sign of good wealth, by their families. And she chose not only to have this child live, but to ensure that he'll have a healthy life in the years to come. And at that point, right then and there, I realized how I couldn't be prouder to work for an organization that had such an impact. And I would like to also say that, thanks to all of you here, to your continued support, this is possible. And I will stop here, but I will continue in the minutes to come. So thank you. Grazie ancora.
Yes. Thank you very much, Eduard. The next person I would like to introduce is Dr. Giovanni Pututo, the head of planning, monitoring and evaluation at CUAMM, Doctors with Africa. He's a medical doctor with extensive experience in public health and development, and he has worked as project coordinator in several health cooperation projects in Uganda, Rwanda, and in Kosovo. He was the head of the Training and International Projects Department of Padua University Hospital, where he had led research and development projects. And his areas of expertise are maternal and child health and health system strengthening, rehabilitation of health systems in post-conflict settings, and HIV, tuberculosis and malaria control. So Giovanni.
Grazie, buona giornata a tutti.
So thank you very much. I'm going to talk in Italian. My name's Giovanni. I am about 59 years old. Together with my wife, Francesca, we've been in Africa for 11 years through this organization, which is called Doctors with Africa, CUAMM, from Padua. The organization was set up by a doctor in 1950. It was set up by a doctor who had spent 12 years in Jordan. He had come back and then asked the bishop to create a context in which young people could study and then work for the health of the others, starting from the young people coming from countries in which no academic institutions were present. So that's the University College of Aspiring Missionary Doctors. So the first Italian doctors started in 1954. Dr. Tasso and Dr. Anacleto Dal Lago in 55 left for Africa, and the first one left for India. Since then, much has been done. We work in 8 African countries: Angola, Mozambique, Uganda, Tanzania, Ethiopia, South Sudan, Sierra Leone, and the African Central Republic. So our objective is health, in particular maternal and child health, that go through the strengthening of health systems. So saying mothers and children first appears to be some kind of a marketing slogan, but there's much behind this kind of statement. The health of mothers and children is the health of 2 groups of vulnerable people. So maternal mortality in the world, especially in Africa, has not yet reached the targets that it had set itself. Out of all the objectives we had set ourselves, this was the objective that is the farthest away compared to what we had set ourselves. The second reason is an equity-based reason. Studies have been carried out on inequalities in the field of health, and these studies have shown that the biggest gaps in terms of inequalities concerning access to health services refer to assisted birth. And the third reason, for which I say mothers and children first, and is linked to the health systems. How do we measure a health system? I mean, everybody here talks about strengthening health systems. Governments aim at strengthening health systems. Big agencies do the same, but actually strengthening health systems can be measured through some indicators, through some services which are maternal and child services. And that is because actually mothers are pregnant for 9 months, but if they have problems, they stay home. So actually the contact to their communities is fundamental. That's paramount, because if there's something that goes wrong, I mean, mothers can refer to a nearby health service. So there must be services in that case. If there are complications, there must be reference services. There must be, for example, operating theaters or, for example, hospitals nearby. So in brief, this is what we mean by strengthening health system. Of course, this is not the only one. So CUAMM, my organization, aims to strengthen these organizations. We work with Doctors with Africa. We go to a country. We introduce ourselves to the authorities. So we ask for permission to work there. We inquire about local policies and programs. We inquire about the areas where certain services are most needed. We go to those areas together. We meet the communities. We meet the local health professionals, and we try and develop projects together. The project is just but a tool. It is not an end in itself. CUAMM is present in Uganda. It has been present there since 1958. So the project is just but a tool. Then we implement activities together. These activities are monitored, they are evaluated, and we then together think about the next step to make the system more and more resilient, more and more capable to meet the needs of the population. So this is the approach that we try and implement. This approach is an approach that inevitably aims at, first, acknowledging the ownership of communities and governments. Second, we aim at focusing very much on training. So institutional training, support to schools, support to nursing schools. We're going to talk about Sierra Leone. In Sierra Leone, there are 2 pediatricians and 4 gynecologists for the whole country. 2 pediatricians and 4 gynecologists for a whole country. And then, a culture based on data and results, and then innovation. And here I would like to spend a couple of words before moving on to the other speaker. So innovation is fundamental. Frugal innovation is what Africa needs. So I consider vaccines to be a frugal technology because it touches upon basic needs. In Uganda, women would go to prenatal visits and then they would go and give birth to their babies in the center. So we asked 800 women. We carried out a qualitative studies with 800 women. When women are called upon to express their views, they do it openly. And they said clearly that one of the reasons why they think that they could not access to the centers was a cultural reason. The labor was in a position that was the Western type position. For millennials, women used to give birth to their babies in squatting. So we introduced a cushion that enables women to give birth to their babies while seated. Then the data were gathered and then they were presented in Washington to present this frugal innovation. I'll make you another example, how to overcome the distance barrier, which is a great problem in Africa. There are no public means of transportation, so we resorted to private means of transportation. We give incentives to people who transport women for 2 or 3 euros. This is just to tell you that today it is fundamental to protect life and the health, and in particular the health and life of women and children, especially of adolescent women, but with an approach that aims at making institutions and populations and communities in Africa more and more independent and more capable of being resilient and answering their needs by themselves. This is what I mean by resilient system. Grazie.
That was excellent, and the focus on innovation will also remain when I hand over to Jacqueline Gaskell to my very left. She is the program lead at Girl Effect. Jackie began her career working for leading London advertising agencies. Since then, she has shifted sectors and uses her marketing and communication skills to improve the health of populations living in developing countries. She has lived and worked in countries such as Pakistan, Bangladesh, Indonesia, and Russia, and has over 20 years' experience working for global organizations such as UNICEF, Population Service International, Maurice Stopes, and DKT, often working on a focus on adolescents. She now works for Girl Effect as the global program lead for the Girl Effect GAVI partnership, using innovative communication techniques to educate and excite adolescent girls about their health and the HPV vaccine in countries like Malawi, Ethiopia, and Rwanda. Over to you.
Thank you very much, Jan, and hello everyone. I'm really delighted to be here, so thank you. I work for Girl Effect, as Jan has mentioned, and we are a non-profit organisation working with girls to change their lives. We were started by the Nike Foundation. I think everyone here knows. I think everyone knows. Is that working okay?
Yeah, need to move
closer.
Yeah,
can everyone hear okay?
Yeah.
Okay. Did everyone hear what I said earlier? Put your hand up if you didn't. Okay, fine. So we were founded by the Nike Foundation, or Nike. Does everyone know Nike here? Yeah. Okay. So we, in a similar way tonight, we develop brands but to empower girls in the developing world. And we work to empower girls to enable them to navigate key moments in their adolescence, which is such a pivotal time for them. And thereby enabling them to live a healthier life, be more educated, and have more financial security. So before I talk more, I'd like to just show you a video of some of the work we do in Malawi, which will give you a better sense of what we do. Thank you. So what we do is we use innovative research methodologies to understand girls and work with girls to create brands that really excite them and resonate with them and enable us to communicate with them about not just health but education and key issues that affect their empowerment. And we use a combination of media technologies according to what best reaches her. So that might be creating a band with a really cool different figures that are band, creating number one hits, and then with those characters creating soap operas and dramas who can tell stories to her about things that are really important to her. And then we might do that alongside doing magazines, doing radio, doing many digital innovations as well as different ways of reaching her. And then also ensuring that we work closely with other partners, such as Akosua's NGO, where we're making sure that our communications work not just at a mass level, reaching millions of girls, but also get through to girls at the community level. And we've worked with GAVI, where Eduard is from, since 2016 to improve the uptake of the HPV vaccine. Now, the HPV vaccine is a vaccine that's given to girls to prevent them getting cervical cancer when they get older. And it's a big problem in some of the developing countries we work with, such as Malawi, Ethiopia, and Rwanda. And whilst GAVI and partners work to ensure the vaccines are available and there for the girls, We work to ensure we overcome the barriers girls may face.
Cerchiamo di fare in modo di superare quelle barriere da parte delle ragazze che impediscono appunto l'assunzione di questi vaccini.
And because we've created a brand they trust and they're listening to, they will digest the information much better.
Quindi recepiscono le informazioni in modo molto migliore.
So let's imagine a girl living in a village in Malawi. She can't attend school every day.
Non può andare a scuola tutti i giorni.
She might have to help with the chores in the house.
Deve stare a casa per aiutare.
She may have her period and not have proper sanitary protection.
Quindi non avere protezione sanitaria giusta, corretta.
She has a lower status in her household.
All'interno della famiglia gode di uno status purtroppo inferiore, più basso.
And assumes her elder brother knows much more than her anyway.
E apparentemente ci sono i suoi fratelli più grandi che ne sanno di più di lei.
She has a limited understanding of her body.
Comprende poco, percepisce poco il suo corpo.
And tends to think only about her health when she's very, very ill.
In realtà si occupa della sua salute e comincia a preoccuparsi della sua salute solo quando è davvero malata.
She thinks that most communications about health are boring and not for her.
Relativa alla salute sia noiosa e non la riguardi.
And she really doesn't understand how vaccines work.
Il modo in cui funzionano i vaccini.
And has never heard of the HPV vaccine.
Non ha mai sentito parlare del vaccino contro l'HPV.
But she may know someone, a relative, who has died of cervical cancer.
Che purtroppo una parente che è deceduta di cancro alla cervice.
Her brother has heard rumors that the vaccine can be bad.
Suo fratello magari le ha detto che prendere il vaccino potrebbe essere una cosa sbagliata.
And she assumes he knows more than she does, and she doesn't know where to get any more information
E lei
anyway.
non sa dove ottenere altre informazioni.
I think you can tell there are a lot of barriers affecting how she can take that vaccine. And that's why our communications and our work with partners to overcome these barriers is so important.
Anche grazie agli altri nostri partner è così importante per superare queste barriere.
I think I'll pause there
Quindi credo che mi fermerò qui.
and then see if Jan has any
E poi
questions for
vediamo
us all.
se ci sono delle altre domande. Grazie.
Yeah. Thank you very much. Sorry. Thank you very much, Jackie. And before opening up the floor to also questions from the audience, I wanted to follow up on a few things that the colleagues on the panel have presented. So, Akosua, you spoke about the need to link both the health and the education activities together. Could you say again why that is so important and what our priorities for each health or education are, or priority goals in the international scene, and how we can achieve them?
Can you repeat your question again? The line was breaking.
Volevo sapere se può ripetere la domanda perché per un attimo non ho sentito in cuffia.
Yeah, why is it important to address health and education at the same time? And what are the priorities for achieving each to reach the international goals?
Okay, so most people think that having good health is only linked to having a good health insurance. But when you look at the statistics and then when you look at my work on the ground, having education is most of the fundamental thing to get good health education. So let's do some stories. Imagine a woman who is very well educated, not only in the classroom but outside the classroom. She knows how to financial literacy. She has been educated to start her own business or is employed, so she gets health benefits from her company. Such a woman knows her health issues and also can place health issues on her children. She knows not only her health issues, but also she knows the health issues of her children. So such a woman is willing to take her children for vaccination. She's also willing to have good food, good healthy food for her children. Teenage girls who are educated can make good health choices on their sexual health, on their physical, emotional, and mental education. And also, we also know that poor health leads to poor education. So young girls cannot learn when they go to school and they are hungry and their stomach is growling. They cannot focus on their education. Then we have the issue of sanitary pads. When girls are missing so many days of school, they cannot go to school. They will stay out of school. And this is serious because then they drop out of school. And we know that once girls drop out of school, we know that poverty is sexist. So most women and girls are the most poorest in the community. And it's because they don't have the necessary education to help them build a good foundation. So when we talk about education, it's important that we also focus on health because these two are linked. We also know that the education is the foundation to achieve all the sustainable development goals. So it's important that we focus on education and also on health because they are interlinked. One cannot go without the other. You cannot talk about education without talking about health because with education, most parents and girls can make excess good choices on their health. They can also afford health care if the government is not affording them with health care. So it is important, it is imperative that these two go hand in hand. So that's why I think we have to work together.
Thank you very much. And the other suggestion that you made and several other panelists is that we need to engage the community. So what do you think is the role of the community engagement and how can we do that? And what should be the role of the government in providing access to basic social services?
Okay, I will do this by giving you 4 stories. A story of the government's failure in providing healthcare to the community and the community knowing the importance of healthcare. So, as he said, imagine a woman who is pregnant and is almost close to delivery, but then on the way to the hospital, the roads are so bad that they have to carry her to cross the road. This is a story I witnessed. By the time we were able to cross that muddy road, she died. That is one situation. The second one, a woman is pregnant and she is close to delivery, but there is no transportation. By the time we were able to get transportation from the city to the rural area, the baby died. This is 2 situations. Now, when the community is empowered, our work focus on the community and making sure that parents know the importance of education and the benefit of that. So every month, we have a parents' conference where the parents will come together and we will sit down because one of the governments of Ghana is charging 20% tax on sanitary pads and it's known as a luxury good. So the parents will come together and they will hold their government accountable. They will hold their district chiefs accountable, and it is so beautiful to see the parents walk to this government official's office and demand that sanitary pads be reduced. So you see, when the community is empowered, they are able to hold the government officials responsible. In the slums in Ghana, we have a huge population in the Greater Accra region in Ghana. People cannot go, the people who live in the slums cannot access health because then they cannot afford it. The government is not willing to offer them health insurance, excuse me, because it is known as one of the dangerous places in Ghana. Vaccine officers are not willing to go to these places because they are scared they will die. And the people do not know much about polio, not even to talk about the cancer virus, the PHB vaccine. So then there is this lack of communication of the people being scared, the government being scared of the people living in the slums, and the people in the slums not knowing about the importance of vaccine. So when it is important, the government, when we talk about health services, not only talk about the hospitals, but also the roads leading to having access to quality health services. So the roads that lead their transportation, making sure that the people are well equipped with the knowledge and skills to know the importance of having access to vaccines, of having access to going to prenatal care, to postnatal care. In some of the rural areas in Ghana, most of the women don't have a choice on their own body, so the husbands will have to decide on the food that the women will have to eat. So you will ask your mother, are you going to eat this food? And she will tell you, no, I'm waiting for my husband to agree that I should eat this food. And it's because they don't know the benefit of a woman having access, having full autonomy over their body. So in conclusion, I think that government has a huge responsibility to the people, because if you have parents, if you have mothers dying just because they don't have access to good roads or transportation and they are dying, if you have the community not knowing the importance of having health care and vaccines, it is dangerous. It is not. We are not going to achieve the health inequalities that exist in our society. So yeah, we have to work together. It's the decision of both the government to provide amenities and access to healthcare, and it's also the responsibility of the community to be educated and know the importance of having good health in their communities.
Thank you very much. And and regarding the involvement of the community, I want to ask Jackie again. So, what is your experience of how to engage the community effectively, and particularly in resource-poor settings where there may be not the technology available that we have available in other places? What's your experience there?
So I think the question was, how do we engage the community effectively? I think the key thing is really understanding them, is ensuring we have really, really strong research. And actually doing research amongst girls is very challenging. So we have developed a technology where we train girls to do research amongst other girls in their community and amongst the community, to really understand what the core issues are and to understand what the key issues are to engage them properly. And then we know that engaging people, often they need positive messages which are inspiring, and things they can do something about, rather than negative messaging. So we will develop messaging and test that with them to make sure it's properly resonates and engages. I think the question was, what do we do in resource poor settings? And that's often a challenge. And so in those resource poor settings, we will want to understand what are the best ways we can use to reach them. And it might be by working with a partner who's working in schools, a partner such as UNICEF, for example, where we make sure our materials get broadcast to the girls in the schools. It may be by working with organisations like Akosua to look at how we ensure those materials get to people in the communities. But we find often that girls can surprise us. We're finding that the use of digital is increasing at a phenomenal rate in Africa. And even when girls can't afford a phone, they find clever ways to get hold of phones or borrow phones and get information from phones. And so that's something we very much monitor, and when we find the girls' use of a phone is sufficient for us to do communications that way, we will do so accordingly. Does that answer?
Yes, thank you. But and another question that several people have already raised: it is important to address young girls, adolescents, young mothers. Why is that so? And why is it so challenging to reach this part of the population?
So overall, it's critical we talk to girls and women. For some of the reasons I've talked about before, there are often many barriers for girls and women, and yet they're often the decision makers in terms of what do their children do. And they also and girls can have a lot of health issues, a lot of learnings around adolescence, around their sexual and reproductive health. And we see, for example, the HPV vaccine, which is given to girls aged between 9 and 14. We see that's a really critical time because it's the time before girls enter adolescence.
proprio il periodo in cui le ragazze entrano nell'adolescenza.
And if we can develop a good dialogue with her around the HPV vaccine, it enables us to talk about other important sexual and reproductive health issues that she may have as she grows up. So I think girls and women is both essential. And often neglected in many of the countries we work in.
Thank you. Excellent, thank you. Now let me turn to Eduard and about the GAVI partnership that he has explained, and it's both impressive partnership of important stakeholders, but it's also a very important financing instruments to finance access to vaccines in poor countries. And GAVI spends more than 1.5 billion US dollars every year in poor countries, and more than half of those contributions come from the European Union and their member states, including the common EU budget and the Italian government contribution. So I want to ask Eduard, how do you decide how to spend this huge amount of money?
Thank you, Jan, for the question. It's actually, I'd like to start with a couple of numbers that I think in my mind are quite staggering. So, ho appena saputo che a Rimini la popolazione...
I've just known that the fixed population in Rimini, it seems that the fixed population in Rimini accounts for 150,000, 250,000. Each summer, with the tourists, they are going to reach 1.5 million people. Just imagine for a second that 1.5 million people, all of them, disappear at once. They disappear because they have not been vaccinated. This is a reality we have in the world. 1.5 children die every year in the world because of causes, because of diseases which can be prevented only thanks to vaccines, which already exist. We are very lucky because we can choose. We can choose either we want our children to be vaccinated or not. We have a clinic close to our homes, and the mothers simply have to cross their road, or they call the emergency number. You receive the health services at your home. Children in Italy will never die because of diarrhea, whereas diarrhea in Africa can kill because there is no access to clean water. Healthcare is not always ensured. You have 2 pediatricians in an entire country, as Giovanni said earlier. So what else do we do? Before answering your question, I will only also say that we collaborate with Jacqueline. Every woman die. Every 2 minutes we have a death of a woman due to cervical cancer. Every 2 minutes we have a woman dying because of cervical cancer. Here in Italy we have a choice. Here in Europe we have a choice. You can carry out tests. If the test is positive, you can take actions and you can survive. But in the 73 countries where we work, women have no choice. And not to mention the fact that prices are very, very high. The 12 vaccines with which we work in the countries have a cost in the US $1,100 for these 12 vaccines. GAVI has managed not only to encourage the vaccine producers, and we focus on African countries. Nobody would be able to afford $1,100 for 12 vaccines. We managed to produce vaccines for $28 only. And I need to thank the European Commission. I need to thank Italy. Italy ranks 6th among the donor countries. And you've been with us for the last 13 years now. So the finance, the treasury minister and the foreign affairs minister have understood that the countries with which we work have seen results, and they continue to support our activities. So I would like to thank you very much. To answer your question, and I will shift to English now,
work is, it's not that, GAVI decides all of a sudden to pick certain countries and administer vaccines. We do not do the top-down approach. We first of all try to understand what are the country's needs. So we try to work with the governments and understand why is it that they haven't financed or they have allocated a certain portion of their budget towards health and towards vaccines in particular. One unique thing about the organization that I represent is that each country has to co-finance a portion of the vaccines, right? So it's not that GAVI gives them the vaccines 100% free. As a matter of fact, the country has the responsibility to co-finance a small portion. So let's say if a vaccine costs, $3 per dose, the country has the minimum responsibility of putting 20 cents towards that vaccine. And as some of these countries progress economically, as we have about 15 countries now that will transition out of our support, they reach the point where they pay 100% of the cost of the GAVI vaccine. What this means is actually two things. One, there's a certain discipline that is instituted within the governments where they realize that they have to have an accountability. There's an accountability exercise. So it's not that, it's similar to the Bible story, right? You teach a man to fish and they will be able to sustain themselves for the rest of their lives. Whereas like this, they put a small portion of their budget towards vaccines, and that means that when they are ready to transition out, they know what it takes to support these vaccines for themselves. We have an independent review committee that exists at GAVI, which reviews all the requests that come from the countries. And once again, the countries, as Jan knows, he's on our board. They're the poorest of the poor, and so the need is there. The challenges are great over the years to come. Yes, we have had fantastic results. More than 760 million children immunized and more than 10 million lives saved. That speaks for itself. But we need to look at, in answering how the money is allocated, not only do we work with UNICEF to procure these vaccines and deliver them to the countries, but then, to your point, Giovanni, we have to understand that the country is ready from a health system point of view to deliver these vaccines. We have to make sure that once the vaccines get to the capitals, where normally they have the cold chain, the fridges that keep the vaccines, that's not a problem. When you move outside of the capital, 200, 300, 400 kilometers inland, it's not so easy to transport the vaccines. And so we have to actually train the staff, the personnel, on how to deliver these vaccines, on what it takes to make sure that these vaccines do not perish, because then all the money that we've invested is wasted, right? Over the past few years, we've been working with we're working a lot with innovation and innovators. And one of the things that we have done is recently in Rwanda and Ghana, we started delivering vaccines via drone. And why have we done that? In some of these places, it's really difficult to actually, reach out to the mountainous areas, or when it rains in the rainy season, you can, as you said before, sometimes it's even difficult to cross the street, let alone go 150 kilometers, sometimes by foot or by boat, to deliver the vaccines, right? And so the drones allow us, from a technology point of view, to go a round trip more than 120, 140 kilometers, 24 hours a day, and deliver vaccines directly to the centers that need them. And this is not the end. We're continuing to work with the civil society organizations, with the various technical experts to understand what the country's challenges are, to understand where we can do more and better. And this is why I'm really happy to know that Italy continues to support us in this noble exercise that is saving a child's life. And for that, I have to say again, grazie ancora.
Yeah, thank you. And just a follow-up on this great partnership that you said Italy is a central part of, the European Union is a central part of. So as we now move into looking what you can achieve as ambitious goal for the next 5 years, what is the role that Italy and the European Union could play to help you achieve the ambitious goals of immunizing everybody?
So thank you very much for that question. Again, the one disclaimer I would like to say is that GAVI is not a political organization. We work with countries such as Cuba and North Korea, where some governments have made it a point to condone these governments. We do not, because we feel that children should have equal opportunities no matter their race, their religion, or the place of birth. I know that today is a very important day in Italy, but I surely hope as well that regardless of the outcome of what will happen at 3 p.m., Italy will continue to support international development. Italy will continue to understand that there are realities that exist beyond its own borders. It is actually a fact that for each dollar that is invested in vaccines, the return on that investment is about 18 times as much. And why is that? Because, as you were saying before, the mothers normally who stay home if a child is sick, they will be able to work because these children will no longer fall ill. There will be a reduced burden to the hospitals that perhaps don't even exist, because those children will be able to go to school, will be educated, and will be able to contribute to their economy. It is something that perhaps very few of you know, that vaccination has generated more than $150 billion in the 73 countries that we work with, and that is not a trivial number. What are we looking at in the next 5 years? Well, in just 2 weeks' time, as Jan knows, we will have there will be a conference called the Tokyo International Development on Cooperation for African Development. Where GAVI will unveil what our ambitions are for the next 5 years, from 2021 to 2025. We're clearly looking to continue what we started almost 20 years ago. And as I said before, while the numbers that we've talked about and the successes are impressive, there's still a lot to be done. And we surely hope that we can continue to count on the European Commission, on Italy, on the United Kingdom, on the United States, on Canada, on France, to help us reach out every single child. Because just as the very conference here says, your name was born from what you gazed upon. We want that child who is about to be born today or tomorrow to become a young adult, to become the one who will tell the story that thanks to your support, thanks for everybody's support, they will be able to create the stories for themselves and have families. And one day when all of us will be retired, we can say with pride that we were part of their story. And once again, thank you so much for that.
Great, Eduard. And yes, and one of the great Italian stakeholders in the development sphere is, of course, CUAMM, that Giovanni represents here. And you already spoke to the challenges of working in fragile settings. Maybe you can elaborate more that we're now being faced by the Ebola epidemic in the Congo. From your experience in West Africa, what is it that we can do to address this while at the same time building the system in the longer term?
Grazie, Jan.
Thank you very much, Jan. Well, we work in the fragile countries, in most fragile countries. In South Sudan, there are 2 million people who were forced to leave their home, 2 million refugees, and 4 million people who were forced to leave their homes. In Sierra Leone, there was a war, and then it was hit by the largest Ebola epidemic in the Central African Republic. The first message is that the fragile countries, in perspective, are going to have the highest concentration of people who will live in extreme poverty. What does this mean? How many times did we speak about the health issues of adolescents, mothers, and women? We're going to have a higher and a higher mortality, which can be avoided. It's a technical expression. People die of causes that can be easily tackled and solved because we have the means, partially, we have the knowledge, so people die for trivial things. in these countries. This is the challenge of the fragile countries. But fragility is a pervasive aspect because it touches upon the services to people, healthcare, education. It has to do with violence towards the fragile people. It also touches upon climate and climate changes. So when a catastrophic event occurs, or a human catastrophe such as a war, a conflict, or a natural disaster such as an epidemic, well, these countries simply collapse. They collapse. And as a consequence, they have a very, very high mortality rate. It was a case of the largest Ebola epidemic of Western Africa. We were there. We were working with the program referring to maternal and child health in a rural district, 360,000 inhabitants, Pujaun. In March 2014, we recorded the first cases of Ebola in Guinea, and then the first cases of Ebola in Liberia. And then in May, the first cases of Ebola in Sierra Leone were recorded, and in July, the WHO declared the international emergency state, and we had the first cases and deaths in Pujau, in the district, and we were there. So first of all, you need to be there. You need to be present. You need to be in the last mile. Because if you are with other people, you are catering for their healthcare issues. And you're dealing with the most marginalized people in the world. What was our response? Well, the first response was that of not raising flags, the flags of CUAMM, Doctors for Africa. We did not raise any flag. The first response was to place in the driving seat the local health authorities and help them. How did we help them? With them, and along with others, we acted before the Ebola cases reached Pujau, when there were cases in Liberia. So we built 3 Ebola holding centers. We facilitated the first contacts between the health authorities of Pujau with the green light of the Ministry of Health. It's a border district, and we worked with the colleagues in Liberia to establish the reduction of transit of people between the two countries. And then we carried out an intervention on the healthcare network. We secured our partners, our operators. We assured them Ebola can be tackled. You don't know it. So training, meetings every 15 days. We organized meetings. We didn't have the PPE, the personal protective equipment. We didn't have any means, so we adopted simpler strategies, waiting for the PPE to come to a district. So we carried out training activities, and then a large investment on communities. Without the communities, you cannot reach any goal. And this is also the case in Italy. The healthcare system will not be able to stand the aging of the population in Italy. We need to recover the proximity networks, the family networks, the friends networks, and we need to intervene as soon as possible before the person becomes acutely sick. The same applies in Africa. You cannot carry out prevention and control of the epidemics if you do not listen to the community first, and you need to establish a trust relationship. You need to listen to the needs of the community. Ebola is a new disease. It is interpreted in a different way. It interrupts a funerary ritual which is rooted in centuries. It is not easy to eradicate a ritual. It is not easy to convince people of the contact raising. It is not easy. Would you say that some of your dearest people have entered into contact with Ebola? Once you've established a contact, the community needs to accept to be isolated for at least 11 days, which is the average time for incubation, measuring the temperature every day at 250 contact tracer. All this was carried out, and then in the end, in January 2015, The Guardian published an article, Pujaun, the first Ebola-free district. That was the result. So I said, well, oh gosh, let's see what happened. Well, 3 questions. What really happened? So what was the epidemic wave, so to say? And then with the help of all the local partners, we collected all the data. We've reconstructed, and we will talk about innovation of methods and instruments when it comes to epidemiology. We've reconstructed all the contact chain from the first people with the illness to the last person. And then we wondered, is it possible to make an evaluation of interventions, an impact evaluation, in order to understand what worked? We, all of us, because of the work we carry out, need to be reflective. We need to have a critical point of view. We need to raise questions. What I'm doing, well, is it working or not? Do I really know the problem? So the survey was carried out, and we realized that the early isolations were effective. 90% of the infected people were hospitalized with 4-5 days on average, because the more time they spend in the community, the more likelihood is there for other people to be infected. And then the second question: did the healthcare system resist this crisis? The system resisted, and the assisted deliveries, none of the 75 healthcare centers were closed. None of them. They all remained open. And this is thanks to the work of the operators, of the staff members, and the communities. And the assisted deliveries increased. 3 districts in all Sierra Leone, and there was a reduction of assisted deliveries. The collateral effect, the side effect of treatment, the fact that women no longer went to deliver, or they no longer took their children for vaccinations. So let's have a look at what happened, really. So we always use a scientific approach. Of course, you need to call for help. You need to be humble enough to ask for help, because the reality is bigger than reality is bigger than us. And the work we need to carry out is bigger than us. So you need to be accompanied when interpreting complex phenomena. And the third aspect I would like to dwell upon, which may be useful for countries such as Congo, the 10th Ebola epidemic. So we need to look at the positive experiences which were carried out. I've mentioned one of these positive experiences, as painful as it was, namely that of West Africa. There's another outstanding experience, that of Uganda. Uganda, before this 10th epidemic, in 10 years' time, Uganda had a first case of Marburg, similar to Ebola. It's an RNA filovirus. Thanks to the surveillance system, Uganda managed to capture the first case and to isolate it. So it was eliminated from the onset. So it is possible. It can be done. So first of all, we need to have an international interventional system for first response. It would be presumptuous and unrealistic to state we can manage alone. You cannot do it alone. You cannot manage alone. When you have big dangers, all the agencies, the communities, the NGOs need to work all together. At international level, we need to have a faster response, a more efficient response. So the lesson learned was that. And then secondly, well, contribution, and that was the development-related work, and everybody talked about it. So you need to strengthen the healthcare system so they become more resilient. You need to invest on human resources, on governance. You need to invest on services, on technology, frugal technology. So it seems to me that today this can be an advice, a recommendation to be given to all those who are experiencing the Ebola epidemic in Central African Republic and other countries. It means looking beyond the epidemic. What is the current situation of Sierra Leone? Sierra Leone has the highest maternal mortality in the world. Nobody's talking about it. So we need to be far-sighted. We should move on to zero maternal death in order to provide continuity. It means working constantly, side by side, the communities, the institution, the local authorities, so that it is possible to reach this objective. We have one doctor from CUAMM and 24 physicians in Uganda, from Uganda. So we should not simply focus on the spotlight. We need to be patient. We need to have a critical kind of view, and we need to focus on progressive activities. Thank you very much.
Yeah. I'd like to open up the floor for potential comments to any of what you have said or any questions to the panelists.
Quindi vorrei che qualcuno fra il pubblico ponesse delle domande ai membri del panel.
Who would like to ask
Chi vorrebbe fare una domanda?
a question on the work with poor countries or on vaccination, on the partnerships, on the engagement,
sulle vaccinazioni,
inequalities,
sulle disuguaglianze,
or on Ebola outbreak?
So I'd like to break the ice. You talked about prevention, vaccination. You talked about the treatment of conditions like infectious diseases like Ebola. Sierra Leone is the emblematic example of the work that CUAMM has done. CUAMM actually made itself very visible because of how and what they did vis-à-vis the disease with the population. There were non-existent health facilities to a certain extent. So I would like to ask the following. From the point of view of surgery, when we talk about Sierra Leone, I know the experience of Lucert. That's a hospital close to Freetown. There's many of them. Many of us actually work there. And sometimes we go and work there. And let me open up some preliminary comment. There was a surgeon, a religious man who died because he was infected with the disease. But actually, I would just like to remind you this extraordinary figure of the missionary doctor. So from the point of view of surgery, how can one do planning in certain contexts? How can one put in place a certain therapy, a therapy that then becomes indispensable?
We can collect a few.
Ottimo, direi di raccogliere alcune domande prima di rispondere.
Nobody for the moment.
Non ci sono altre domande per il momento.
Then maybe Giovanni, you could take a response first.
Rispondere a questa domanda?
Then could you talk a little bit about Ebola?
Grazie nel ricordare.
So thank you very much for the fact that you reminded us all of Padre Manuel. We opened the Lumsa hospital once again because that was closed because of this tragedy. There were 9 casualties, including this surgeon who was the director of the hospital. So surgery is yet another Cinderella in Africa. There's a very big need, unsatisfied need of surgery, at least in Sierra Leone, especially in rural areas. A big surgeon, a good surgeon, does not only do a cesarean cut, but he manages to work in many, many other settings. So we try and cover this function when this is not feasible. And then we try and lay the foundations for the identification on the spot of local capacities, either of young African doctors who are eager to learn, they really are eager to try, they want to try, or in most extreme situations when no local doctors are present, we use technicians. Actually, in Mozambique, the surgery technicians have been invented. In other words, these people learn about 7 or 8 general surgical operations, but that already makes a difference in a very large area. So we also have this kind of education pathways, which also go hand in hand with the anesthetic component, anesthesia training, because the two things have to go hand in hand. All of these are expressions of the weak situations that is present there, which is particularly serious in general contexts, in which this kind of surgical operations, like the ones that you thought about, but this first answer to these surgical operations cannot but kind of outline a future evolution, so that one can then eventually find sustainable solutions that are also connected to the growing capacities that we really hope the country will find. Thank you.
Yeah, thank you very much. Now I would like to... there's another question. Yeah.
Buongiorno.
So good morning. Can you hear me? So good morning. I have a question for Jacqueline. I would like to ask you, first of all, what activities are carried out to promote training, to do this kind of training among young women and also young men, because this is always a very difficult topic to deal with. It's always very, very difficult to enter the personal sphere of young people. And then I'm also curious about the following. How do young men and women put themselves at stake? What kind of activities do they perform? Are they performed in day centers for adolescents, or are these activities carried out in schools? Are there specific pathways in schools? And then, do you have meetings also with the mothers to then check and make sure that something changes in the households as well? Thank you.
One more question? Oh, yeah.
I have a question on vaccines. Is there a point of arrival, so to say, or are there political issues in some countries linked to wars or to specific local situations that in a specific moment like this do not enable you so that, for example, that you can say, okay, given these resources and in a given time, we may be effective in the territory where you are working? Yeah, and I'll add up on this. When I attend conferences like this, there's always a question that comes to my mind. I always ask myself, what can I do? What could I do? It's always very nice and beautiful to see what other people do. So you wonder how you can help, how you can be part of these beautiful projects. So, as many contributions come from Western countries, from Europe or America, for example. And as we talked a lot about education, in your opinion, how important can education be, not only in the countries concerned, but also in the Western world, here. Because, yes, of course, we do watch commercials on TV, we have the internet, we have many channels from which we can get information. But at the same time, we are overwhelmed with information sometimes. And so most of the times it's very, very difficult to concentrate on the things that are really important. It's very important to select the information that we should receive, because ultimately we are talking about serious things. We're talking about human lives. So personally, thinking about my educational pathway, I would have very much liked to have occasions also at school to get to know certain realities, certain problems more in depth. I would have very much liked to be more aware of what my contribution could be and could have been. So this is my question to you. Do you think that it is important to kind of intensify information during the educational pathway, not only in Africa and in other underdeveloped countries, developing countries, but also in the developed countries? Thank you. I would just like to tell you about one thing that happens during your working. Like when you talk with people, when you talk about these problems happening in Africa, which apparently are far away from us, the Ebola problem or young women getting pregnant, the first reaction that you get in a developed world like us, for example at work, everybody simply stops about what they could do so that these young people kind of solve the problem in terms of reproductive health. I mean, what can we do in order for young women not to get pregnant? They are limited to that, to this issue. And they kind of skip all the first things that you talked about. I mean, we know nothing of what you mentioned before. You've told us a lot of nice things about education to these communities, education to these people. So the idea that we have is that actually we have a very superficial knowledge of these problems. And this is also one of the reasons why I came here. I came to this meeting because I wanted to have more information. I think that many people are really ignorant. They are not aware. We all have some kind of an average level of education, but still we have a very superficial knowledge. We are only worried about the fact that, these young girls do not get pregnant. So everybody thinks about the fact that they should use more contraceptives. And they all skip all these parts, the part concerning vaccines, the part concerning education. This is just something that I wanted to point out, simply because actually you work at a very high level. I really would like to praise you because you do extraordinary work. And actually I wondered whether you are aware of the fact that there is such a superficial knowledge in the Western world of what you actually do. I might tell something more. For example, in my working environment, I came here, I got more information. I would like to know how I could spread the information I got here in my working environment. This is something that I wanted to share with you because this is something that really touches me very deeply. We only stay superficial. We cut all the rest. Thank you.
We can respond to the very rich comments and interesting questions. So maybe, Jackie, you can start addressing the first question, but then also the broader question, this communication that we learn how to do to young girls in poorer countries, how can we use the knowledge learned to also educate ourselves or our populations, and then also while addressing a specific health issue, whether it's family planning or a vaccine, what benefit is there for the broader health and social progress?
Okay, I'll try. Okay, so I think the first question was around what activities we do, what training, and how we bring in men as well as women, or boys as well as girls.
Talk about the politics of vaccine.
So I think that's a really good question. Thank you. Boys are important too.
And could I ask you,
and we found, for example, in Malawi, when we started to do the research for girls, and there's a massive inequality in Malawi for girls versus boys. But a lot of work had been done for girls, not so much had been done for boys, and the boys were getting quite annoyed. So actually, when we developed that brand, we developed it. We developed for boys and girls. What we had found is that in Malawi, girls and boys would mix together until they were around age 10. But after 10, it was the boys would keep very separate to the girls. They couldn't have like friendships together. So we tried to build a brand to address that. And I think, so all of our work is with boys too. And you asked us about what activities we do. And I think that's really important, as you're implying, that what we're trying to do is to get to as many people as possible, but also have activities too. So as we develop perhaps TV soap opera or a radio soap opera or magazines that are getting to lots and lots of people, we will also work with NGOs, so maybe like the Girl Guides or organisations working with the girls and the boys at the community level, and develop activities around those materials. So we will do like trainings, enable girls to understand, and boys too, what they can do. We also do things like, it depends on the infrastructure in each country, but in Ethiopia, for example, they have a set-up in schools which are called mini media groups.
Okay. Can you talk?
And what we do there is we work with the girls on those mini media groups to enable them to develop their own campaign and their own messages around the HPV vaccine and other issues too. So you asked also about how we ensure mothers are part of this, and I think that's a really good question too. What's really interesting to us is our materials target adolescents, but what we find is a lot of mothers and fathers listen to and watch those too, and use them as a way of developing a discussion with their girls. And that's something we will very closely monitor and research to make sure that what we're doing is affecting those around the girl too, and making sure it does have an impact on that household decision-making process. I hope that answers okay, Ian.
Thank you.
And then you both asked, you gave us a big challenge here. I think it's a really valid point. I would say, personally, education in schools is so important in Italy, in England, I think this whole Rimini exhibition is just so exciting because it is starting to do some of that. I personally think it would be great if we could find ways of enabling people in the schools to understand the full picture for girls and boys and understand how all these different issues affect them. Because I think the first thing you can do, the most important thing you can do personally from this Rimini is sharing what you've learned. But that's a very personal. But I also think you've given us a challenge too, which I'm going to think about.
Okay, thank you. Eduard.
Proverò, a rispondere. Grazie per...
So first of all, thank you very much for your questions. The first thing that I would say is thank you very much that you came and attended this session. That's the first step to learn a little bit more. And then to answer your question, there are circumstances in which it is very difficult to give vaccines. Of course, we work in Afghanistan, we work in Yemen, we work in the Democratic Republic of Congo, we work in Mozambique, where there was a hurricane. So we work in countries which are not only politically weak, but which are also impacted on a very large scale by natural disasters. We are all in panic. If I were to tell you, okay, I'm coming from the Democratic Republic of Congo, and I met someone who had Ebola, all of you would disappear. But if I tell you, okay, I was in Mozambique, and a young child had diarrhea, nobody would escape, nobody would flee. So, when talking about Ebola, the good news is that talking about Ebola, GAVI started to immunize the health professionals in the Republic of Congo, and since the 1st of August, 181 vaccines against Ebola were given, 2,700 cases were registered, and 1,800 casualties due to Ebola were registered. And at the same time, in the same country, 120,000 cases, so 2,000 cases vis-à-vis 120 cases of measles, and 2,000 casualties linked to measles. So that's a piece of news that was not reported, and nobody would tell anything, because apparently measles are not something that would come here from the Democratic Republic of Congo. While if you talk about Ebola, everybody gets panicked about that. So I think that it is, I think, first and foremost to say that it is important that you are here, and then when you get a certain piece of news, look at the facts, look at the reality, just kind of select the fake news from an actual news, and see that actually we all represent here organizations which work in these countries, and we spend our lives and all of our time to change this perception. So thank you very much once again. Thanks a lot to the European Commission for their kind invitation. Thanks to the Rimini meeting for allowing us to be here. And my suggestion to you, please continue being our ambassadors, so that you can spread the good news that the world is changing, that it is changing for the good, that there's lots of many reasons to be optimistic. But of course, this is work that has to be carried on.
Ask Akosua and Giovanni also to respond to the question, what is it that we can do from here to address health inequalities across the world?
All right. Thank you. So 2 things that I had: how can we make education intensify? How can we intensify our education system? And how can we help? So the first thing is that I think we need to change. I'm speaking from as a Ghanaian and as an African. We need to change our education curriculum, because the education curriculum is solely based on education. It can have girls go to school, and I'm talking about girls because as you had every panelist say, girls and women are the most endangered. We are the most vulnerable. So I'm focusing on girls. We can go to school, graduate, and girls will never know about gender-based violence. They will never know about STDs. They will never know about teenage pregnancy. So I think that our education curriculum must be changed, because we, as a country, Ghana is very conventional. We don't talk about sex. We don't talk about gender-based violence. We are into this silent culture because sex is sacred. But I think it's important, as we've seen here, that our girls need to know. Our girls need to know how to prevent it. They need to know how to protect themselves. So we need to change the whole education curriculum. Talking about how you can help, I think it's important to know that girls in Africa are no different from girls in Europe or girls in America. We all face the same issue. We all face the same challenges, although in different geographical locations. Our lives are intertwined. Rape culture, gender-based violence, not having access to quality education, being paid less. We all face the same issues. how you can help. There are a lot of nonprofits who work on the field in Africa. You have UNICEF, you have WHO, you have CUAMM. One way is to go to their websites, read about what they do, and subscribe. Subscribe to their newsletter. So every time they talk about something, you'll be the first person to know. That is one thing. Also, make it if you want to know more. I think the good thing is to volunteer with the organizations that you work for. Although I'm an African and I live in Africa, I don't know a lot of things that happen. I went to Uganda last year and I worked there for 3 months. It was there I experienced poverty firsthand. The young girls and boys walk to school barefoot. They don't have access to shoes. That is something that would never happen in Ghana. I'm not sure about that until I went to Uganda. So I think also how you can help is to give your time, to volunteer to these places, to know what is happening, to learn about it, and then to come and to share with your other colleagues or your children or your peers at school. Another thing is also to advocate. Advocate. Thanks to social media, there is a lot of information that happens. You go to Twitter, you put in Me Too movement, and you will see a lot of things that happen to women. You can join in the movement and you can advocate. You can hold your government accountable. When I was in Brussels for EDD, one thing that we did as young leaders is to hold EU officials accountable, is to push them to change their funding policies to make sure that other orphan countries in Africa get access to funding. You can also engage in activism. As I said, girls in Europe or in America are no different from girls in Africa. We all face the same situation, so collectively we can all come together to help those in Africa, to help those in America, to help those, because one girl left behind is too many girls left behind. So I think those are the ways that you can also help. Thank you.
Great, thank you. Giovanni, very short.
So I'll be very brief. So good information, solid reading, then promotion, doing advocacy of these rights that we find in the world, and then each compared to what one can do, you should do a step forward. Go to Africa, observe what's there. Do not criticize, just observe and come back. And if you have time and the resources, then in the field of education, the field of health, in the field of enterprise, in the field of art, bring together a part of your time, spend part of your time for poverty in Italy and for poverty in Africa, in that same sector, and then follow that tiny bit for years. In other words, spend yourself. And if you do that, you will find the differences. You will find the similarities. You will find the intuitions that people can have, the different reaction capacities that people can have, the reaction capacity of services, the legal aspects. Just, cross the problem from one side to the other for years, not for just 1 minute, not for a summer alone, for years. Do it for years, and that will be a beautiful enrichment for you.
Beautiful advice. Thank you very much. So I would like to bring this very rich discussion to a close, and I think we looked at all the various aspects on how access to health and health services can be improved, and the barriers that abound, whether it's financial, whether it's governance, whether it's other non-financial barriers. And the challenge is immense and will not be solved overnight, but it needs a collective contribution of all of us, and wherever we work, whatever our background is, we all can contribute to this great cause. And from the European Commission, we know that in the EU we operate our health systems based on values that are shared across the European Union, that is based on that everybody should have equal access to good quality care, and we hope we can also, through our development cooperation programs, instill this into the programs in our partner countries around the world. So I would like to thank, first of all, the panelists for their great contributions, to the audience for their excellent comments and questions, the organizers, and particular Grégoire Lacroix, my colleague who has been organizing the session. So thank you very much, a wonderful day, and all the best. See you. And I would like to hand over to Eduard for some final points.
Beh, questo
This is a task that was given to me by the organizers. I would like just to remind you that the meeting is a unique event for 40 years. The extraordinary, it is the result of the contribution of everybody, from artists to speakers to the visitors. Everybody gives something to the meeting, and it is thanks to this that for 40 years there are exhibitions, sessions, and they are for free for those who to participate in the meeting. And that is why our donations are decisive. It's not important how much you donate, it's a gesture of responsibility for the realization of this unique place so that this continues being. To this end, in the trade fair area, you will find counters called Dona Ora with a red heart label, and donations will have to be made only there with volunteers wearing that red t-shirt. Thank you very much.